So welcome everybody to this month's video message. Now we've done something rather different, as you can see, joined by my colleagues here. I've been reflecting on death and I just thought we probably don't talk about it enough. So I think there's this notion of a good death. Is it our role in the hospital to help people have a good death? What is a good death?
I think that's the really interesting thing. We have these expectations on ourselves as nurses, as doctors, as healthcare professionals, to deliver a good death in the hospital. You know, people have individual expectations of what a good death is, and I think that's influenced by their personality, by their culture, by their faith, by their backgrounds. So I think it's probably an unsurmountable challenge to deliver a good death when we actually haven't got a definition of what a good death is.
I think it's the last great taboo, isn't it, that no one talks about. Everything else is talked about, discussed, it's on the internet, it's everywhere, but no one talks about what's going to happen when you die.
We use all sorts of euphemisms, don't we? Passed on,
do we use them in the
passed
hospital?
over.
And
Yes.
how helpful is that? Or is that colluding with this we don't talk about death stuff?
Within the hospital, I think we avoid talking about dying and death, even to the point that it's RIP, isn't it? We even make it even shorter so we don't even have to talk about it.
Oh gosh, it's true, isn't it? Do you think that's a new thing, that we don't like to talk about dying?
Well, I've got parents who are in the 80s,
Yeah.
and I don't know what they want to happen to them when they die. Do they want to be
you
buried,
work in the
cremated?
bereavement office, Alison,
Yeah,
so they
and they know that.
Bring your expertise. What do you think? And why do you think that is?
I don't know, to be honest. I don't know, because I've worked in not only in the hospital but in the funeral industry as well. And again, you meet people who say, well, we didn't discuss what would happen when they died. They didn't want to talk about it. We tried, but they didn't want to talk about
I think
it.
we're frightened of it.
Yeah,
So
It's fear.
I was with two families yesterday
Yes.
preparing funerals,
Yes.
and one was an 87-year-old fella, and I asked the family, as I always do, how he'd want his funeral to be. Oh no, never talked about that sort of thing.
Yeah.
And I can think of the number of funerals I've put together. I've only had two where people have said, yeah, here's the list.
Yeah.
It's just so helpful. Otherwise you're playing second guessing all the way through.
Yeah. Now I'm sitting here thinking, have I? No, I haven't. But I tell you what I have done, and I think this speaks to my fear. So my fear is what happens to me afterwards, because I've got this terrible anxiety about all of the options, so name them. So being buried, I can have a great concern about the creepy crawlies.
Yep.
So that's off. Being cremated, that one, I saw a James Bond film once where the man was in the... Have you all seen that one, where he's inside the coffin and trying to get out? But I haven't ever discussed or talked to anybody in my family about the process or where I'd like to be, or it's so challenging.
Could I say something?
Yes, Marjorie.
My husband died of dementia after 15 years, and he was in a research programme up at Charing Cross at the time, until he could no longer do it. And I knew exactly what he wanted. We had discussed it when he was first diagnosed. So when he died, I'd been to the undertaker previously. They'd said, we'll collect his body and we'll whip him over to Guildford. They removed the tissue that they wanted and sent him back. And I really wanted to make sure it was him I got back. So I did ask, I wanted to see him in the coffin. My daughter and I went. So then when he had died, they were still looking for people to research, sort of with so-called normal brains at the moment. So they were looking for volunteers. So I said, I'll do it. Yeah. So my daughter is very well aware of exactly what's to happen to me when I die. I've paid for my funeral. I've planned everything. It's all written on paper. I've been through it with her, and it is not a problem.
Every other element of our lives, we're organised. We organise ourselves, a job, a house, holidays. We plan strategically. And this is a massive event. We can't, we've only got one shot at it.
What I find interesting is when I spend a lot of time breaking bad news to people and telling people bad things, but invariably they don't ask me how long have I got. They won't want to talk to me about that. They'd rather talk to the nurse about that. So there's an interesting deference between what a patient wants to talk about with the doctor
Yeah.
and with other people.
Yeah, it's interesting,
I think that's quite a barrier at times.
And sometimes when they ask a question when they're not maybe in their last hours or days of life, lots of people aren't really sure that they definitely want the answer to that anyway,
Yes.
because they want to live in the moment. So we have people that say, this is what I got told by my oncologist,
Yeah.
and I'm looking at them.
It's the question you
And
get
then they're
from the
asking me
media.
again, and I'm like, do you actually want to know the answer? And then they look at me. I'm not entirely sure I do.
I was wondering, Rosie, you're a junior doctor, a young doctor. Do you feel confident and prepared to have those conversations with your patients?
Yeah, I think when I was first starting out, I found them really intimidating. I could see with the other juniors when someone was dying, they didn't want to confront that. It almost seemed like giving up, because you go into medicine like kind of focusing on, prolonging life, delaying death, saving lives, whatever you want to describe it as. But I think now, having worked in palliative care for 2 months now, still a really short amount of time, but I have those conversations every day, and I think the more you have them and the more you realise how important it is for families and patients to be aware of how much they want to be aware of. It just gets easier, and I think it's just something that happens with experience and time.
Was it discussed at medical school? Was there much time spent reflecting?
Not really, actually.
Death.
We had maybe 2 days in palliative care.
2 days out of 5 years.
Out of 6 years, yeah.
Wow.
Going back to a point you made earlier, I think for some people there's a fear of getting it wrong or saying something, and I think a lot of people recognise and want to say something, but that fear of getting it wrong and upsetting everybody, and then if you're a bit junior, it would be, who gave you that authority?
It's so interesting. Miriam, what's your experience as
Well,
a
it's like
staff
whether we
nurse?
do we all need permission, regardless of which role, even healthcare assistants, they're spending the majority of the time actually with patients and are most available to have a conversation. But are we comfortable talking about our own death? Have I made a plan myself of how I want to die? So I often think about it. If I want to be able to be comfortable having a conversation with someone else about their death or with a family member, have I actually gone this through myself, regardless of how old I am? Because we do, people are faced with death at different ages. Yes, we talk about the 90-year-olds but it can be any age that you're dealing with death.
We're getting to a sense of it here, aren't we? We have to have the conversation, which means we have to recognise it, which was really your big message, Claire, at the discussion we did, wasn't it? About recognition. So thank you all. I've really enjoyed that conversation, really, and you've really landed. I suppose I started this conversation thinking, will this conversation help us think about what we can do or what we must do in the hospital better, differently? And to some extent, we've reflected on some of that. But I think what I've really taken away is this is a much bigger debate, and actually we can do our bit in the hospital, but it's really a societal thing. It's all of us. And please go away and have this conversation with yourselves, your family, those important people in your life, but also with patients and their families, or enable them, empower them to do so. I'm certainly very keen for you to do that when you think the time is right. So please contact members of the team here if you need more support or information. And really, please talk about death.